Welcome to the Repugen Podcast, where we transform patient care.
Welcome to another episode of the Repugen Podcast. I am Jennifer.
And I'm John.
Today, we're unpacking one of the most detailed healthcare consumer studies we've ever discussed, how patients across the U.S. actually choose healthcare providers, and what demographics reveal about trust, satisfaction, and decision-making.
This conversation matters more than ever. Patients today behave like informed consumers. They compare, research, evaluate, and switch providers based not just on care quality, but experience, communication, convenience, and reputation across digital and in-person touchpoints.
Choosing a healthcare provider isn't a casual decision. It impacts cost, access, trust, and long-term outcomes. That's why this nationwide survey of 545 patients gives us powerful insight into what truly drives patient behavior across age, gender, income, region, and device usage.
And what stands out immediately is this: patients don't all think the same way. What matters to a 25-year-old on an iPhone can look very different from what a 60-year-old Medicare patient values, even when seeking similar care.
This study analyzed responses collected nationwide in June 2025, blending structured survey data with open-ended insights. Respondents were segmented by age, gender, income, region, and device type to uncover patterns shaping healthcare choices.
Some groups had smaller sample sizes, so those insights are directional rather than definitive. Still, when viewed collectively, the data paints a remarkably consistent picture of how modern patients evaluate providers in a competitive healthcare landscape.
Let's start with age. Younger adults, especially those aged 18 to 29, are highly digital. Over 78% actively research providers, and more than 82% avoid providers entirely due to bad online reviews, showing strong sensitivity to reputation.
Contrast that with patients over 60. They research less, rely more on insurance acceptance and credentials, and are far less likely to avoid providers due to negative reviews. Trust, familiarity, and coverage outweigh digital perception for this group.
Insurance acceptance ranks highest across all ages, but factors like bedside manner and credentials increase in importance as patients get older. Seniors place heavy weight on qualifications, cleanliness, and respectful communication.
Younger patients, meanwhile, prioritize convenience, digital access, and reputation. They're quicker to switch providers and more reactive to poor communication or negative online sentiment, which makes experience management essential for retention.
Across all age groups, the top reason patients leave providers isn't clinical quality. It's feeling rushed or unheard. That single issue outweighs billing problems, wait times, and even insurance changes in many demographics.
This highlights a universal truth. Patients value being listened to. When communication breaks down, trust erodes quickly, regardless of age, income, or region, making soft skills a primary driver of loyalty.
Gender differences add another layer. Both men and women actively research providers, but women tend to decide faster and show slightly higher loyalty once trust is established, especially when communication feels empathetic and respectful.
Men, on the other hand, spend more time researching and place greater emphasis on credentials and experience. They're also slightly more sensitive to negative reviews, reinforcing the importance of visible expertise and reputation management.
Women report feeling rushed, unheard, or disrespected more often than men. Poor bedside manner and lack of empathy disproportionately impact female satisfaction, making emotional intelligence critical for retention.
Men are more frustrated by unclear explanations. They want direct, understandable communication about conditions and treatments. These insights show why communication training must adapt to different expectations, not follow a one-size-fits-all approach.
Income dramatically shapes how patients research and choose providers. Lower-income patients focus on insurance compatibility and access, often spending less time researching due to limited options or constraints.
Higher-income patients are far more selective. They research longer, prioritize credentials, convenience, and reputation, and are extremely sensitive to bad reviews, with some income groups avoiding poorly rated providers entirely. making online presence a direct revenue driver.
Meanwhile, middle-income groups balance affordability with experience and convenience. They're loyal once satisfied, but still willing to switch if operational inefficiencies or communication issues persist.
Region matters. In areas like the Middle Atlantic and New England, patients prioritize credentials and experience more than reviews, and loyalty tends to be higher when expertise is emphasized.
In contrast, regions like the Mountain and West-South Central place heavier emphasis on insurance acceptance and affordability. Meanwhile, review sensitivity is highest in the Pacific and Middle Atlantic regions.
Over 98% of respondents accessed healthcare information via mobile devices. Android users tend to research longer, value credentials, and rely heavily on reviews, while iOS users favor speed, convenience, and quick booking.
Both groups care deeply about insurance and cleanliness, but Android users consistently rate more factors as important, signaling a broader, more analytical decision-making style compared to iOS users.
Across demographics, dissatisfaction is driven far more by interpersonal failures than technical ones. Feeling rushed, poor explanations, lack of empathy, and long waits dominate complaints.
This reinforces that clinical competence is expected. What differentiates providers is how patients are treated, spoken to, and respected throughout the care journey.
Insurance acceptance is non-negotiable. It must be clearly communicated everywhere. Without it, patients won't even consider a provider, regardless of quality or reputation.
Reputation management is equally critical. Nearly 80% of patients avoid providers due to bad reviews. Monitoring, responding, and encouraging feedback is no longer optional.
Appointment availability, cleanliness, and staff professionalism consistently rank high. These are controllable factors that directly influence trust, satisfaction, and long-term retention.
Providers who invest in staff training, empathetic communication, and smoother operations outperform those focused solely on clinical outcomes. Experience is the differentiator patients remember.
Younger patients want digital convenience and fast access. Older patients value credentials, insurance clarity, and trust. High-income patients expect depth, while lower-income patients need affordability and simplicity.
The most successful practices tailor messaging, experience, and digital presence based on combined demographic traits, not just age or gender in isolation.
This research makes one thing clear. Patients are rational, experience-driven, and highly selective. They expect transparency, empathy, efficiency, and trust across every interaction.
Healthcare providers who align operations, communication, and reputation management with these expectations will build stronger loyalty, better outcomes, and sustainable growth in today's patient-first healthcare economy.
Thanks for joining us on the RepuGen podcast. Understanding how patients think is no longer optional. It's the foundation of modern healthcare success.
If you want to turn patient insights into action, tools like RepuGen help practices monitor sentiment, manage reputation, and improve experience at scale. Until next time, keep listening, adapting, and putting patients first.
Thanks for listening to the RepuGen podcast, your path to better healthcare.